Hi, my name is Dr. Ellen Chiocca, and I am the author of Advanced Pediatric Assessment, published by Springer right here. It is in the 4th edition right now, and it is a book that is written expressly for the advanced health assessment of children. And the reason that I wrote this book was because I was teaching advanced health assessment to family nurse practitioner and pediatric nurse practitioner students about 20 years ago. And the only book that addressed pediatric assessment was a pocket book that was written in outline form. It was small enough that it could fit in your lab coat, but I wanted a full-length text. So there was a representative, a sales representative that came to the university where I was teaching, and I asked him if he had one that was, or knew of one that was full length, because what I was teaching from was one of the classics that already exist. And how it works is it addresses history and physical taking of the adult. And then at the end of the chapter, there's about a page and a half. Oh, by the way, if you have an infant, oh, by the way, if it's a young child or a teenager, you do this. But it's much more detailed than that. It's much more complex than that. So he said no, he did not. But then roughly 2 weeks later, he showed up to my office and said, here is a packet to write a book proposal to write a book like this. And I thought he was kidding around, and he wasn't. So I spent the summer working on it, and it was accepted, and I did it. And the reason as I said, the reason I wanted to do this is I wanted to start out with a chapter, and chapter 1 in this book talks about it, lays the groundwork for why with every age group in children, infants, toddlers, preschoolers, school-aged children, and adolescents, there is something different about the history, the psychosocial stage, and the physical development of the child that needs to be taken into consideration. And that there are critical sensitive periods of time in development. There are specialized knowledge and skills that you need for each group. So the child's age, their developmental stage and level, their past medical history, and their temperament need to be taken into consideration. There are some children that on paper should be able to be examined on the table by themselves, but they're extremely sensitive and shy. So they would need to be examined on their parent's lap. So I explain in the book how the provider can sit face-to-face with the parent, knee to knee, and create sort of a table with their laps to do some of the exam on, not the entire exam. The history varies greatly according to the child's age, who is giving the history. So, for example, obviously an infant can't give their own history. But once a child becomes around 11, there are some sensitive psychosocial issues where we need to give the child a choice to have the parent in or out of the room. And the physical exam is different according to the child's age. Health assessment of children. What is new in the 4th edition? So I have a revised chapter on mental health assessment. So in October of 2023, the Pediatric Nursing Certification Board that certifies pediatric nurse practitioner students or certifies pediatric nurse practitioners has on their website, the test blueprint for their board certification exam. And growth and development was, so they list in descending order the focus of the questions on the exam. And growth and development was always on top. As of October of 2023, in tandem with that, they have moved mental health issues. And so there are a variety of reasons why that American children are having more mental health and developmental diagnoses, which is beyond the scope of this discussion. But be that as it may, there is a new and revised chapter that discusses that. And also I expanded the section on trauma-informed care, which is important for the provider to become familiar with what that is, and to keep in mind when they are taking part of the history, when they're doing the social history, and who's living with the child and what their circumstances are, or if they're working with newly arrived refugees or migrants, that they keep all of these factors in mind about mental and physical trauma. In one of the last chapters, there was one about clinical decision making, which has also been revised to include how to make a differential diagnosis and more detail on diagnostic reasoning in children. So that's different. Also, I added something on the telehealth visit. So the third edition was published, I believe, in 2019, and that was pre-COVID. And so there's some information on the telehealth visit, which became a necessity during the pandemic. There's also some discussion on the impact of the pandemic on children's learning and their mental health. Another question to address is, what are some common mistakes that are made in child health assessment? And so if a person is deciding to go back to become a family nurse practitioner and has never worked with children since undergrad, we all have, everybody knows the neural pathway in our brain. We have habits. When we come home and we pull our car in the driveway and we walk to our front door and unlock the door, we're so used to that, it's just become an ingrained pathway. It's the same idea when you've always been working with adults and you do a head to toe physical exam as part of your initial assessment at the bedside. And that was ingrained in a nurse to make sure that nothing is left out. The problem with that with children is you can't do a head to toe assessment until a child is at least 3, sometimes 4. And the reason for that is, if you start to, and don't forget, you're going to be doing more advanced assessment. So as a bedside nurse, you're not looking in a child's ear or the back of their throat to be thinking about, diagnosing Coxsackie virus in their throat or acute otitis media. When you do that with a child between 6 months and around 2.5 to 3 years, they will scream bloody murder, which is developmentally normal, completely developmentally normal. And if they're sick and febrile and they don't, that means they're really sick. So you would expect that. The problem with that is, if you do head to toe, is then when you want to get good breath sounds and auscultate and listen to their heart sounds and their bowel sounds, if they're sick, they're screaming and you can't hear anything. So from age 3 and under, you have to start auscultating first. You auscultate the chest, you listen to the lungs, the heart, and the bowel sounds first. Just to summarize, you need to auscultate the chest and abdomen first, and then do ENT last, because they will be screaming. Hang on to the book after you graduate, or if you have bought the electronic version, you can pull it up on your phone and look things up while you are in the clinical area so that you make the best decisions that you can.